Hi, this is Boss. Here are some tips to file a medical negligence case in India. Number one, be sure to document everything in your time in the hospital. This is besides the copy of all Indo papers and the discharge summary that you receive. Be sure that you keep a notebook with you before your family member or the person gets admitted. Make note of everything before, during, and after. Choice of words, key words, date, time, and supplement that with a official letter wherever possible. Number two, a consent is not a consent to withhold or misdiagnose people. Any consent form, any acceptance form that you sign doesn't give the right to go against the general norms that are set by governing bodies. It doesn't give the right to withhold use of any particular appliance or any particular part during any particular operation. Number three, the diet and the medicines should complement each other, and as per the ailment it should help the person recover. Very often it is seen that any medical negligence may not be noticed by the other person because we don't know about what is the diet prescribed. I had to face an example like this when I underwent stenting surgery right here in Pune, in a hospital, where I was told to drink any amount of liquid or any liquid that I wanted post my surgery. It just so happened that at that time I loved black tea a lot, and I kept on having excessive amounts of black tea, and they kept giving it to me. I kept asking for it, I kept getting it. No dietitian advised me against it. No doctor advised me against it during my stay in the hospital. The only difference was I happened to read the news, being an avid newspaper reader. I happened to read in the newspaper that day that black tea helps lower blood pressure. Whereas at that time, I was getting medications to increase my blood pressure and bring it up to normal. It had been the second day, and I was one, and the hospital staff and doctors were wondering why is the blood pressure not rising. What they were doing is they were documenting that I was receiving diet as black tea, but nowhere did they advise me against it. This itself, even if the patient asks for it, is negligence. Number two is the medication you receive. There were times when I was in hospital that I used to ask every time I got a medication what was it for, demand to see the expiry and the manufacturing date, and also check the records how many times has the doctor advised it. There were times when one shift changed over to the next shift, and the nurse in charge did the new person on duty did not know that the injection was already given, and she came with another injection to give me a double dose of the same injection. This is again negligence. The way you can find it is versus the prescription, versus the Indo papers of the drugs administered, and versus the handover that was given from one nurse to another. Here, you don't sue the nurse, you can sue the doctor and you can sue the hospital, because they are part and parcel of the services provided to you for the fee that you are paying. This is one of my starting series on how to claim damages in India. I've had an experience of watching medical negligence cases in person at the National Consumer Redressal Forum. I have seen cases where the judge asks, "Show me where is it written that this happened," and the person goes on a story on talking about the pain, the suffering, the feeling. Here, the judge is asking, show me the facts, tell me the merits, whereas the other person launches one point and expands it into a story. This is what helps, this is what goes against you rather than helps you to lose a medical case in India, argue on merits, be on points, and talk about treatment versus protocol versus the documentary evidence versus what was said or done to you. All in one line makes sense to the bench. Only the feeling or only what you claim is not enough. Your claim has to be substantiated by what was the protocol. The protocol has to be substantiated by their report. Their report has to be substantiated by what was said or done to you. Another thing is, when you want to file a negligence case, it can be if a part of your body was damaged when you went for one thing and came out with another. Second, wrong protocol or wrong treatment was followed. The wrong advice was given to you, like in the case of the diet example which I shared. Here, wrong advice was given to drink any liquids. Treatment was against the accepted medical norms. Any part being left inside the body, any instrument being left in the body, removing the wrong body part, a homeopathic doctor giving allopathic treatment, non availability of medical supplies, including oxygen cylinders, any steps not followed to the book, and whether checking whether the treatment was given as per diagnosis. So these are some steps that you can follow to ensure you win a medical negligence case in India. Like in the case of against Leelavati Hospital, where they did an eye surgery and a doctor, no less, lost his eyesight because the instruments in the hospital were not sterilized, and they were the clothing material used in the operation theater was washed in the laundry along with patients used apparels that are used in the hospital, and because of that some excreta found its way into the operative clothing, and E. coli, which is an extremely dangerous form uh, of infection, was contracted to the patient because it transferred from the cloth over to the patient's eye, and in the process the patient lost his eye. Maybe this would have passed off as just another case and maybe an adverse damage or maybe some other external factor, but the fact that this happened with more than one patient on the same day in the same hospital within the same on the same floor is what made it prove to be a medical negligence case. One of the things, always remember, whether you go to hospital, don't expect to find whether there'll be negligence or not, but be extremely sure to document everything so that if there is negligence, you have an upper hand in all conversations, discussions, and if you were ever to take them to court, you have an upper hand in everything. Record everything. There is no law which prevents you. You are absolutely free to place a recorder on the table and press the record button on. You are paying for a service. They are providing you the service. They bloody well do exactly the way you tell them to do things. And to bring back the Leelavati case, here it was only because that doctor who lost his eyesight was vigilant enough to know the previous patient and the patients around him that he was able to prove negligence. Similarly, when you're in a hospital, it's always a good habit for those around you or those being operated on the same day, around the same time, you will definitely run into them. It's a great habit to keep track of such things. The housekeeping staff, the pantry staff, these are people whose numbers you should always have. These are the backbone of any medical institution, and they have access to every nook and corner of the hospital. They can tell you things that go wrong, they can tell you things that go right, they can give you inside information which otherwise you would not have access to. I hope this video helps you. In the last 10 minutes, I covered how to sue a medical institution in India, what you should have against you. I made a note of one case that you should, of Leelavati, that you can refer to. The case link will be in the description. Thank you.